root canals, endodontic work, endodontal work, root canals, you know, the whole world compares everything bad to and say it's as bad or worse than a root canal, you know. Root canal and taxes are kind of like really, you know, at the same level. But they really are not as bad anymore as they used to be due to the way you guys give injections and stuff. Also, most of us, I have found, have a misunderstanding of what a root canal really is. Tell us when a root canal is needed, what it kind of is, and why is it not anymore painful if you dentists can actually use that word, not no pain, legally. But go ahead and tell us all about it.
I have to cough. We're gonna have. Sorry.
See, a root canal makes even a dentist cough. I mean, you know, so maybe there is something really bad about it.
No. Actually, root canal, I was just thinking because I don't know where it got its reputation. In my years of practice, I don't really think that root canals itself, the treatment, are bad, but that is exactly what I hear all the time. Oh, I hear that they're so bad. You know, whenever we're finished, they go, that was it? That's the root canal? It's just, you know, it's kind of like these urban legend stories that come out. People just pass them down and say, oh, you're having a root canal, you shouldn't, oh, it's the worst thing ever. But nevertheless, you know, it could be because, again, like you said, the way we give injections now or the methods that we have. One of the things that I feel and I find that when we are having trouble when controlling somebody's pain and they've had a bad experience with a root canal, it's not necessarily with the root canal that they've had the bad experience. It's with the fact that they've waited very, very many months to have the decay taken care of. It started hurting 6 months ago, but it kind of went away because I took a little bit of aspirin or a little bit of this. So it calmed down, and then you just ignored it, and then 2 months later it started hurting a little bit more, but I took a little bit more Advil, and then it just kind of took it away. So the third time it comes around, it isn't as forgiving, and the pain is really tremendous, and no matter how much Advil or Tylenol or whatever you have, your neighbor's medication next door that, you know, had a surgery and gave me the pill, that's not going to work because the infection has taken over so much. And that's when you have the horror stories of root canals, because you've waited, people have waited so long to get them treated. The infection has gone beyond the tooth and to the surrounding areas of the root, and that's why it's hurt so much. But the reason people need root canals is because they have had decay, a cavity in the nerve tissue that has created inflammatory cells to kill off this nerve. And so whenever people start having pain or have even sensitivity, it's because the nerve is inflamed and needs to be taken out. It needs to be cleansed out of the roots. And that's where the root canal comes in. I always, my philosophy as a dentist is I am there to educate, but I'm there to save teeth. And if there's ever a chance that I can save teeth, that's really what I'm there for. And that's probably one of the best examples of where I think we do our best job, where people, and where I see that our bodies are very forgiving because we've created this trauma for many, many months, and we can still have a chance to save it. And so we do a root canal, and we clean out the infection, the infected tissue. We let it heal. We give antibiotics if needed and pain medication if needed, and wait for our bodies to just take over in the healing process. Once the healing has taken place, the pain has subsided, and things have calmed down, people can look at things in a different way and say, okay, don't take it out. Oh, I'm glad I didn't have my tooth taken out. What happens is when they come in and they've had pain for 3-4 days straight, they haven't slept for 3-4 days, the first thing they say is, I want this tooth, just take it out, I don't want it. So, again, once everything is calm, once the pain has subsided, once the infection has been taken care of, they have the ability to step back and say, okay, I'm glad I didn't do it. We had the root canal, then we put a post, and then we put a crown on this tooth. And it's just been probably one of the better things that we can do in dentistry. The second chance you can give your tooth to exist in your mouth is by doing a root canal. And I've seen teeth again, 20 years down the road, I've seen people for many, many years where they've had teeth last them as long as I've been out of school. So I think it's a great procedure, done properly. If it's followed by the patient coming into their appointments, I think it's a great procedure.
Well, as you said, like you pull this tooth out, especially for some of the people who, let's just say, have a price consideration, a root canal and a crown on it. It is a huge difference between pulling it and stuff. However, as you mentioned in other videos, a missing tooth creates havoc in the mouth. It makes the teeth kind of go shifting even all the way to the front. It may take a while, but it will happen. And it makes the bone, to the degree that there's no tooth in it, shrinking, the jawbone, that again, if it's only one tooth, it may not make you look like grandma with like a dried out tomato, but it will start shifting and it will start doing things. So now, no matter what, here's the short, you've got to replace that tooth. So now, instead of root canal, you're going to have to put an implant in it or a 3-unit bridge. One way or the other way. Like with everything else, if you don't take care of it at the beginning, it will actually cost more. And if any one of us thinks, which we sometimes do, that while we do that next year or 2 years later, we have more money, how often in our life does that really happen? And if we do so, wouldn't we much rather spend it at Disneyland rather than with a dentist? I mean, let's face it. Yeah.
With a dentist in Disneyland?
Or with a dentist in Disneyland, well, I'm sure your kids and your husband would agree to that very much.
Yes, they would. It's probably right on it. But no, yeah, you're absolutely right. I mean, my profession, my job as a dentist is to educate people, to save the teeth as much as I can. And of course, you mentioned a very big issue right now, economics. The fact that, people say, why is it so expensive to save a tooth? That's why I mentioned in previous videos that it's, preventative dentistry is so much cheaper and it doesn't hurt, and why not do it? But once you're finding yourself in this predicament where you need a root canal in order to save a tooth, you can do it. You can, it might take you a little longer financially, but you can do it because you're right. Eventually you're going to have this replaced. But one of the things I always ask people, and maybe it's not the right thing to ask, but I always ask, if your finger was hurting and you went to the doctor and they said, well, it's going to cost so much money to fix that finger, would you say, just cut it off? I don't get this. It's a tooth. It's kind of like a finger. You're supposed to have 28, and once you start taking them out, you're kind of taken away from the complement of the 28 pieces. So it's the same thing, and maybe people don't, I mentioned it earlier as well, that we take our mouth for granted, and our teeth are just as important as a finger, as a toe, as any other part of the body that would say, I probably would not tell my doctor to cut it off or, just take it out. We do that all the time because we say, oh, it's a back tooth, nobody's going to notice it. But maybe nobody's going to notice it, but your body will eventually notice it because all your teeth are going to move. You said it, it's going to move. It's going to take some time, yes, but it will move. And that's going to create a discrepancy with your bite. It's going to create gaps on your teeth. Then it's going to create problems with your jaw because your ligaments are going to be stretched in a different way because you're biting a different way now. So it's a kind of a ripple effect of things.
Right. And that too, and you did mention it in the other video that that problem with the ligaments in your jaw, basically your hinges here, can create muscle tensions in the neck, in the lower shoulders, and even headaches, which again, we're talking lifestyle. And the bad part about it is that, the lifestyle bad is bad enough, but then people start going to all kinds of doctors and do all kinds of things, spend money, spend time, have a discomfort life, and because it is only a missing tooth, the whole world, there isn't a physician out there who's going to look at it as the cause, and thus it will not be found. And you will have headaches and muscle tension till eternity.
I would tell anybody that is suffering from that to actually look at your teeth, look at your mouth, and say, am I missing any teeth? Could that be the cause? whether it's missing teeth. Also, just the bite itself, if you've never had braces and your teeth are crooked to begin with, maybe you're not missing any teeth. But that in itself can cause all these ligaments to stretch, muscle tension, headaches, you name it. Once again, this is what I'm talking about, how we take our teeth for granted. It is so much of an integral part of our body, and we just don't even look at it that way. We look at it as most people don't. I shouldn't say we don't all, but it makes me so sad sometimes when people say, just take it out. Because, again, it goes back to, but it's a part of you, and if you could save it, why not? But, again, I also understand the situation. If people cannot do it and they're in pain, I'm the first one to say, you know what, if you can't do it, you can't do it. I mean, you can't suffer with this pain either. But I've seen a lot of times where people could do it and should do it and just don't. But I'm here to educate them. I'm here to try to help them and to make them understand why it's so important to have that.
Well, Dr. Martinez, like almost very, 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 very informative, a little bit scary, but at the same token, you do not scare us without giving us actually hope for a solution. Not just hope for a solution. You tell us that there is a solution, and that's kind of like, a good thing. It's one thing to tell a guy, he has a problem and not have a solution, and it's another thing tell him he has a problem but there is a solution. Solutions in life, be it in economical, in private, in marriage, it doesn't matter. They don't come easy. Life is a game, but they are there, and most people can work it, and that's why you have it. Thank you very much for again being so super candid. Bye-bye, Dr. Martinez.
Thank you. Bye.